it's Sarah here from BJC Health, coming to you from Sydney, Australia. Thanks for showing an interest in one of our educational events. You're about to watch part one, so enjoy the event. If you've got any questions about the content, then please consider joining BJC Connect, where you can access all of our facilitators live. Otherwise, please consider leaving a comment and we'll do our best to get back to you.
Okay, so I'm hoping everyone can see my screen there. Is that correct? Perfect. So today's presentation, a bit of a chat. Feel free to ask questions whenever you need to as well, but we will be talking about exercise strategies for a better bone and joint health, and then starting off with obviously that better bone health side of things. Okay. So I think it's important for everyone to start to understand what is the normal, what is expected over your life, so that we can then differentiate from that. So I really like this graph actually because it's so nice and clear, but essentially what happens is we have quite a big increase in your bone growth from the years of obviously birth to about the age of 20. So one research study said that you get about 95% of your bone health by the time you reach your 20s. Okay. After that point, males are lucky here. You get a little bit extra. Us females are a little bit below you guys in terms of how much bone and formation we do get. And we find that the female bone health actually drops off a little bit quicker than males as well. So what that means is essentially we do normally see a dramatic increase, and then it does taper off a little bit with age as well. Roughly the 20 to 30 years, that's when it's roughly at its peak. It declines after that. Okay. All right. So important thing to note here is that during puberty, in fact, we do actually have the peripuberty stage, which does mean that we get bone growth on the outside of the bone as well as the inside. That helps to make it really nice and strong, which resists fractures, and obviously assist that developmental stage where we are growing so quickly. After that point, post-puberty, we find that we get less of both of the forms of bone growing, and it tends to only be a bit more on the outside, so it's less. So it tends to mean a little bit higher risk of fracture. And yeah, anything, a bit of torsion, anything like that, it's less resilient towards. So we're lucky during the stages of pre-puberty, but afterwards it's up to us to keep exercising to keep everything healthy. But we'll talk about that in a moment as well. Okay, so I would like to hear from everyone here what they actually think might be normal bone loss. So there's a bit of an A, B, C, D option here. I might have to get Sarah to help me facilitate this one if that's okay. But options are about 0.5% a year after the age of 40, 0.5 a year after the age of 45, or 1% for after 40, 1% for after 45. Is there any way we can poll this, Sarah?
Well, I just want to encourage everyone to drop it in the chat. So this is your chance. Thankfully, you only have to write one letter and just have a go. If any of you were here for Fabio's talk, yeah, it's a good way just to see, yeah, I guess your current level of knowledge. There's not going to be tests at the end, but just have a guess. And I'll just give Caitlin, we've got one for D, Caitlin.
Okay.
Everyone just have a go. Wait, give them a little bit more time. Another D, we've got an A, D, a few Ds, A. Give you another 20 seconds. Oh, hide it, Caitlin, hide it. C. We've got a C. D, another one. So D probably seems, but A. D is probably in first place, followed by A. But there's also C. I don't know. This is good. Good question. A real mix. So what's the answer?
Okay, beautiful. So good guesses. It was pretty tricky because I did leave it a bit tight.
Very close.
But general rule of thumb is that we do lose approximately 1% of bone mass per year after the age of 40. So essentially 10% a decade. Now, again, us poor females, I do apologize, but we do lose a little bit more than males. So women can lose up to 20% of their bone density within the 5 to 7 years after menopause. So it's approximately 2 to 3%. So it's amplified compared to the 1%. But I promise you, it's not all doom and gloom. It is okay. All right. So it is normal to lose a fair bit, and that's just due to the drop in estrogen that happens as well. Okay. So other factors that do influence a normal loss of bone is lifestyle factors. Depends how active you are, how sedentary you are, what your exercise background is, how your nutrition is, if you're keeping up with good calcium intake, genetics, other medications, some steroids and things, they all have a bit of an effect on bone mineral density. But there's a massive list of medications that all have a bit of an effect as well. So we won't go into that too much today. Okay, but like I said, everyone, there is hope. Okay, so what can we do? For osteoporosis in general, we do have the options of medication to support it. There is a study that came out that did actually look at soccer players, which was quite interesting, which were 30 years retired. And they looked at their bone health at that point and compared it to age-related, so same age individuals, but those that weren't as active in adolescence. And they did find out that there was a significant reduction in fractures and fracture risk when doing an assessment in those that did participate in soccer or any other team-related sport. So I did find that quite interesting. Other things we can do is start exercise at any point in time. Like I said, there's hope. It's never too late. We'll go into a bit more detail about that later, but it's also important to note that things like calcium and vitamin D can really help as well. So it just helps with that absorption of the, for your bone health as well. Okay. All right. So title as an exercise physiologist. Yes, this is the part I'm likely most passionate about. So let's get ready. Buckle up. Now, exercise is extremely important for bone health for many, many, many reasons. So I'm going to start going into a few of them for us. But mechanical load associated with exercises like weight-bearing exercises, which include things like walking, jogging, climbing hills, going upstairs, they all actually subject the bone to good, healthy mechanical stress. So it's against gravity. So that load, it can then assist bone formation. So essentially by applying little bits of pressure, it's treated a bit similar to, I guess I could liken it to muscles, how if you exercise, you get tiny little micro tears in the muscles. They then come in, clean it up and make it stronger so you've got a better foundation for next time. Your bone is similar to that. It likes to have a good, healthy stress, then come in, get more of what we call osteoblasts, which are bone forming little cells. So they come in and make it stronger again for next time. So it creates that resilience. Now, we also get a bit of dynamic loading from just the simple ground reaction force. So pressure that the ground gives back to you. And again, that also increases that osteoblast, that bone forming activity. Again, enhances the density. Okay, now with every muscle contraction your body has during resistance exercise, which we will talk about later, again, I know I'm saying that a lot, but it does pull that muscle on that little bone attachment area. And again, that's healthy mechanical stress. And this tension does help to stimulate more of that bone formation. So think about the little bits of pulling from the muscles plus resistance that you get from general loading during weight-bearing activities. Okay. Now, exercise is pretty good. It is what I like to say, a bit of a drug cabinet. It does release a lot of different things. Many of those things are also hormones. So exercise, particularly weight-bearing and resistance, they do influence the release of hormones. So some of those in particular are a bit more of your growth hormones and your sex hormones. And again, they all play a massive part in your bone formation. Like I mentioned when I talked about the bone loss post-menopause, one of the sex hormones, estrogen, does decrease after menopause, and exercise can help with that a little bit. It can also reduce your level of cortisol, which is a bit of your stress hormone, and that then that stress hormone itself can have a negative effect on your bone density. So by taking the time out, exercising for your mental health as well as the physiological, it does actually assist your bone density. Lastly would be the calcium intake. Funny enough, exercise and regular exercise can enhance the calcium retention in the bones. I did a bit of extra research on that one because it is actually a really small area that people don't talk about too much. And I did find it quite interesting. So the evidence is definitely there that it can have increased intake if you keep regular at your exercise. Okay. So keep using words like weight bearing and resistance, exercise, but yet if you're like me, maybe 10 years ago, you probably were like, what does that even mean? So weight bearing, we generally define that a little bit as exercise where your bones and muscles simply just work against gravity. Now that can be things like doing body weight exercise or even exercises with an additional load. The additional load can simply be water bottles or backpacks filled with things, or it can be an environment in a gym, which is holding a dumbbell, so a big weight, or on machines. It can be many different things as well. It's important to note that it is a positive physiological stress, and that does help that, again, the osteoblast activity of helping to stimulate the remodeling. Okay, so a lot of things that this can include, I've listed a few there, but running, hopping, jumping, a bit of volleyball, skipping, all of that kind of stuff. That's a bit more of your weight bearing. So again, body weight or a little bit of additional load. Now it's a little bit different to our fellow resistance training, and that typically is strength training applied against a large external load. And that then is a bit more where you see the gym environment. So they are similar but different. So that is where you'll get to see more of your weights, your machines, your pulley bands that you might see us giving everyone in clinic. We do love them. Or household items, like I said. Okay. So when it comes to osteoporosis, please keep in mind, always talk to your allied health professional. I just want to preference that before we get started, because your advice does have to be tailored to yourself, and you need to make sure your safety is there too. Everyone's got different goals, different stages, different levels of ability. So please take this with a bit of guidance, but not directly do it, okay? So generally for osteoporosis, it's known that high intensity is the best way to try to stimulate a notable bone adaptation. And high intensity is defined as that 80 to 85% of load. Yeah, random number. But what that means, if I was to try and liken it to something that we'd all resonate with a little bit more, would be saying if you were to do an activity, it'd be like 8 out of 10 difficulty. Okay. So with a load as heavy as that, it does require, like I said, the machines or other weights to do that. It should be completed, if we're looking at research, twice a week for around 30 minutes a day. A little bit more is always better. I do like people to try and push for a bit more, closer to 3 times a week, which does follow the research suggestion of 90 minutes. Okay. And again, supervised by an exercise professional. I really urge you to do this because you're working with heavy loads. We need to now look at your safety, how you move. Do you have the mobility to do certain movements? And yeah, you're lifting something heavy. It's not a matter of throwing a kilo or 2 around. It's heavy. So you do need to make sure you're moving well. With any of the resistance exercises, we do need to look at your major muscle groups. For osteoporosis in general, we do know that your back, hips, they're generally a little bit more affected. So we do like to do a lot of leg work and back work to try to strengthen up that area to support you the best. Okay. All right. That was a lot to digest. So I hope everyone's still with me. And yes, there's another element here. So we've just talked about the weight bearing and resistance exercise. And yes, we still need to look after your heart health. With that, though, it's lucky because simple walking, if you're going for a long duration, quite brisk, it helps to maintain the mobility. And that, like I said, the ground reaction force of each step can really help with the bone density as well. So if we're following guidelines, 30 minutes a day. And yes, I know we're starting to talk about a lot of time here, but it's important to note as well that swimming and cycling, they can be good things to maintain the cardiovascular fitness side of it, not necessarily bone health, but the cardiovascular. And with osteoporosis as well, it comes hand in hand. You do want to decrease your falls risk too. So if you don't have a fall, we don't have to be as concerned about fracture. So 4 times a week, roughly 30 minutes. And please challenge directions. Don't just stand still on one leg. Try and move about. Try do a funky little thing. You might look like you're dancing every now and then when doing it, but it's good to try not stand still and do it all the time, because in life, we do move about all the time. Okay. All right, Sarah, I think it's a good time to pause and see what questions we have.
Yeah, good job. So yeah, there was a lot to go through there. So we've got one question so far, but this is again good chance for everyone else. If again, feel free to ask some specifics, because I think Caitlin's done a good job of giving you those sort of broad concepts. And as much as we can't give totally individualized advice, yeah, if you have some questions about how to then apply that, or if you want some assurance that you're doing the right stuff, or some advice on how you could change your routine to be a little bit more loaded on the bones, then obviously let us know. But have a go at this one, Kate. This is a great question. It's a bit tricky though. I can help you out, but I'll read it out to you. You can have a go. So Mally's asked, in arthritic joints, I think osteoarthritis, which we'll probably talk to in a little bit, why is it easier for the body to accumulate bone in those more arthritic joints than other bones, e.g. the pelvis? And does it get calcium from these bony joints? Like, does it get taken from other bones? Do you want to have a go at answering that, or do you want to just go, Sarah? You can have a go, because it's a good question, just in terms of that arthritic and extra bone. And then, is that good bone? Does that mean someone's bone density is a bit better? Yeah, go for it.
Yeah, it's actually a really great question. And Sarah's right, it is actually quite a complex one. So the way I interpret that question is, when we do look at arthritic joints, say knee osteoarthritis, what we end up getting is little bits of extra bony formation, which we will talk about soon, but bony formation around that joint line. And that is particularly there to try and support the joint, because it has lost some of its cartilage per se. So it's coming in and trying to restructure that joint to give you support. Whereas anything related to the osteoporosis side of things is looking at that whole bit of bone in itself, rather than just that joint line edge. I think that's what the question's asking for, but Sarah, do you want to jump in and fill in the gaps?
Just add to it. Yeah, but good answer. I think, it's not as, I think if you've had a scan, so I think those of you, there might be some of you that had your bone density scan at BJC. We used to actually have a machine at our Parramatta clinic, and I used to do those scans. And so it would be common at times for, even though we're looking at the lower back and the hip, that we would start to pick up some of this extra bone. And like Caitlin said, that can be a normal part of the osteoarthritis process, but that extra bone doesn't help with the strength of your bones, unfortunately, because you might think, oh, great, extra bone, good, right? At least my arthritis is kind of helping my bone density. But unfortunately, that bone isn't as strong. It's not sort of placed in the way that really supports you. It's part of that, your body's actually just trying to manage the inflammation as best it can, but it's not quite the same as, the bone that we develop when we're younger, just as an example. But it's not that it's taking calcium and moving it. It's not quite the same as that. So again, I think Caitlin's message is very much about whatever we've got, because none of us can go back and change what we did up until the age of, 25, unfortunately. Now it's all about maintenance, doing what you can. And yes, if you are in a position where you can improve it, great. But at the same time, anything that you do to now continue to support those bones is going to be better than nothing. So bones, it's great. They continue to adapt right up until you die. They don't ever stop. So I think that's a very good thing to know. Same with our muscles, thankfully. But that's why sometimes, yeah, that extra bone doesn't necessarily mean you're in a better position when it comes to bone density. So great question. I think we've got one more. I knew someone would ask this, Rose. So great question. We might leave this till the end, but I'm going to ask Caitlin so she knows it's coming. But Rose has shared that she has trouble walking because she has severe osteoarthritis in her ankles. What other exercise could she do? Because she's got severe osteoporosis. So that's a great question. We might save that till the end, Rose. Another great question, is your advice good enough for people over 80 years old? Maybe Caitlin, you can tackle that now, maybe just with your approach. How would you tackle seeing a client who's over 80? Would you still give them some of these messages, or what considerations might you have if you were starting to work with that person?
In short, absolutely yes. It's never too late, so do not worry about that. Yes, my advice does work for anyone that is wanting to get started over 80. I believe, again, go and see your allied health professional, whether it's a physio and exercise physiologist. They'll be able to assess you properly. But the most important thing is starting gently, giving your body time to grow and adapt with it, rather than going guns a-blazing and going and lifting something massively heavy. You really still need to prep and prime your body before you go into doing something like that. But yes, it is still appropriate for anyone of any age. Bone health is always adapting.
Yeah, great answer. And then last question before we move on to joints. From what you've read, Caitlin, do you think exercise can slow the decline of bone strength? So I know you sort of gave us that beautiful chart at the start. All of us, unfortunately, are on that slippery slope of reducing. But again, from what you've read, do you think if you're engaged in some regular high intensity weight bearing type exercise, can we actually slow that decline down, do you think?
Yes, absolutely. I think it can be slowed, again, with the assistance of medication if you are at a stage where it is required. But yeah, absolutely. I do think it will slow the decline, especially if you can catch it a little bit on the earlier side, like I mentioned. But at any age, yes, it is worth either assisting with a plateau in where you're currently at or slowing the decline. And there are some cases that if you're really dedicated, that I have seen improvements in bone mineral density no matter what age. So I did even have someone come in the other day, a beautiful lady, and we've had quite a few success stories of a little bit of an increase in bone mineral density since getting started. And it's really important for us to all hear little success stories. Just keeps you more motivated to keep going.
That's a good point, because I think it can be tricky with bone density because it's not something you're going to measure all the time, and everyone on this call tonight might be a little different, but generally you're not going to assess it every 6 weeks or anything like that. It's more going to be years. So whilst you're kind of waiting for your next scan, you kind of do have to trust the process. And although there's probably going to be lots of other benefits that you notice, the only way we can really get that measure of your bone density is having that DEXA scan, which again, your doctors and your healthcare team, can advise you as to when it's appropriate for you to go for that. But yeah, again, it can definitely slow the rate down. So again, very positive message. But yeah, I'll let you continue, Caitlin. How about you go into your section on joints?
Yeah, fantastic. Just before we jump into that, I think it's important as well that to note for everyone that with resistance exercise and doing all of these things, any research is going to tell you going for that higher intensity, that impact training is what's going to give you the most benefit as well. But just please note that it has to be when you're ready to do so and when you're feeling safe to do so as well. So please do seek guidance on that. And Sarah's absolutely right. The benefits are slow every 2 years, might be when your scan is, just depends where you're at. Okay, so we'll start going to the joint side of things now. I think this is also another hot topic. I got given 2 really good hot topics, so I'm quite excited. All right, so joints over the lifespan. Similar to a bone, I wanted to set, I guess, the precedent of what is normal, what is abnormal. Now, we have a beautiful synovium within the joint. So essentially, it's a bit of a sheet, and it produces a good fluid in your joint. So it's just on the outside of your joint, and it provides that lubrication. It gives your cartilage a bit of nourishment, gives all the good nutrients into it. You then have the cartilage, which sits between the two joints, and that's a nice smooth surface for the joint to get nice and mobile. That is nice and cushy, especially when young. Your bone is then the third factor. And look, it does start off really nice, strong and smooth, as we already talked about. 20 is pretty much your peak, maintains to 30. Over time, though, that synovium, so that fluid, we get a little bit less of it. And that does then mean if you have less of that lubrication, things just get a little bit sticky. So there's a bit of friction. The cartilage then, because it's got less fluid to nourish it, and also just the normal process of aging, it gets a little bit thinner and less elastic. It doesn't bounce back as much. Think of it like a cushion. And if you really, really use a cushion a lot over time, it just gets a little less bounce back. The bone, we already talked about it. You get a reduced density, and there is a presence of some spurs. So like the question said, we can get a little bit of extra bone formation around that joint line.
So you've just finished watching part 1 of one of our recent educational events. Hope you enjoyed the content. If you'd like to access part 2, then you need to sign up for BJC Connect. It's a free platform where you can access not just the recordings of past events, but also access a whole range of upcoming future events and access our team of facilitators live. All of the details that you need to join BJC Connect are now flashing up on your screen. Otherwise, like our staff, subscribe if you'd like to see more information from BJC Health. Look forward to seeing you in an event soon.